Okay, thanks. Thanks, Mark. Be back. So our guest tonight, Dr. Veronique Mead, she was a family doctor and is an assistant professor who then did a pivot for all kinds of reasons. I'm sure we're going to find out, and retrained as a somatic trauma therapist, and found subsequently that 70 to 90% of risk for chronic illness is actually not genetic. And finding this lens between trauma and the nervous system that we've talked about a lot is a very powerful lens for making sense of your pain or of your chronic condition. And that's why we're going to talk about this link and why it's not all in your head. So, welcome, Veronique.
Thank you. Good to be here. Good to see everybody. Good to meet you, Mark. And my name can be a little bit weird or odd. It's French Canadian. It's Veronique. And please
Veronique.
go ahead and call me Veronique. So good to be here with you all.
Okay, great. Well, I love that the topic for tonight, and I think it's one that a lot of people can resonate with. And I first came across your website quite some time ago when I started to notice that that the research that you had was something that I hadn't been able to find before. It's so comprehensive. And so, yeah, I'm just wondering if you can just get us started with a little bit about your own story and what led you to have such an interest in this topic.
We find our ways in unexpected, unplanned things, don't we?
True.
When I was in medicine, I ended up getting the pull to want to shift. All kinds of reasons. It's always clear in retrospect. And the way I would summarize it right now is I had a sense that symptoms were intelligent and that they wanted to say something. And I didn't want to be putting a Band-Aid on something. I really was curious about what might be driving symptoms. And chronic illness was not a particularly strong interest of mine at the time, but I ended up leaving, taking a year off to kind of reassess the direction, and then discovering this program here in Boulder called Naropa University that had a master's program in somatic psychology, which I'd never heard of. So people who train in this become therapists. You're getting a therapy degree, but the focus is about learning how to listen to the body, learning how to be curious, learning how do you ask questions, how do you pay attention to sensation or images or impulses, and how do you look for what's intelligent and what might be happening underneath. And so when I was at Naropa, and my last year of medicine, I started getting tired. And I would think a lot of you have probably had the experience before the everyday presence of a symptom or an illness, that it would show up for a little while, maybe for a day or two or three, and then disappear, and you'd think it was gone, and I would forget about it. That's when you do when you're in good health. And when I would get the spikes of fatigue, I would be so tired that rolling over in bed at night was effortful, which was kind of a shocker. And when I thought it was stress related. I thought taking a year off would be helpful, changing paths to something that felt more aligned. And instead I got worse. And a lot of us still, when you hear about it, people still talk about stress being the risk factor. And if we just decrease the stress, then we can recover. And I suspect a lot of you here have tried that, and it has not been enough. That would be my guess for a lot of people. And if it feels helpful, I can show some slides about what I learned. And essentially, when I was writing a paper in my first semester at Naropa, and I was writing about what they call in the somatic psych, what one of the faculty had written about in a book. They called it an addiction, a somatic process that becomes an addiction, where we have what she called these movement tags. You know, like someone might just pull at their ear all the time when they're a little nervous and you don't even notice you're doing it, or you clear your throat. It's this nervous tick kind of thing. And in her therapy practice, when she would follow this with someone and they'd get curious about it, you can discover that there's actually something going on underneath. Maybe it's something that wants to be said that can't be. And so I was writing a paper about this topic, and I thought, we're talking about the psychology of things, these movement tags that link to psychological events in the past. Could this happen for chronic illness as well? Could there be something hidden underneath a physiological symptom like a chronic illness, like multiple sclerosis or rheumatoid arthritis or chronic fatigue, which I didn't know at the time I had? That's what I eventually was diagnosed with. And so I started thinking about it and looking for an example. And it was, why wouldn't any sensation has physiology happening underneath that's driving it? And so what I ended up doing was wondering if trauma was a risk factor for chronic illness, because we have a better understanding. This is still not commonly accepted, but we have a diagnosis for veterans who have been serving in war, and we call it PTSD because we know that there's symptoms of anxiety or depression, or the spikes where they go way up and have a big startle response or can't sleep. Those are all linked to very specific events they've experienced in war or in whatever setting, that really humans were not really designed to be exposed to these things, certainly when there's not enough support. And so we know that PTSD is linked to trauma. And I wondered if chronic illness could be linked in similar ways to trauma. And I took a dive and started looking into the medical research literature to see, is there any evidence at all? And that was 25 years ago. And I have a database now with 13,000 articles in it. They're not all trauma-based, but there's a lot of data, but it's a lot in silos. So there's a lot of research in type 1 diabetes, for example, the most of any I've seen. There's some in rheumatoid arthritis. There's some in chronic fatigue. And you start to see it that people have looked at very specific illnesses. And what I've been doing is really putting it all together, because that intelligence thing, I think, is what's happening, including with chronic pain.
Right. And including chronic, yes. So you started to notice this in yourself, and unexplainable, like, why am I getting so tired? Like it must have been, and I know, like you said, for a lot of the folks here, it's very confusing when something is not going away. Like it's still, and then it kind of waxes, and it, like, pain waxes and wanes, and you think, am I going crazy? Like I'm trying to do everything right. And so that's when you started diving under the symptoms without even without having a diagnosis yet. Um, and had you already given up your medical? Okay, before you really knew what was happening for you.
Yeah,
Huh.
and it was years before I started really thinking that, this fatigue thing that's going on for me was getting very slowly and subtly more and more limiting. I used to be really active. I used to be into sports. I'd go for long hikes. I've climbed the Grand Canyon, and over time, I remember going for a hike one day with a friend, and we went much further than I'd thought. And it took me 3 weeks to recover. And that was part of the weirdness of it that I'm sure many of you have experienced too. When we're healthy, you get a scratch, you hurt your arm, you have a fall, your body scars over, it heals. And I was listening to you and Mark in your central sensitization video. Your body knows how to recover. And that's why it can be such a shock in our own systems when we don't.
Yeah.
And for the longest time, my fatigue would come and then go. But then it would come for longer periods and it wouldn't go back quite down to normal. It's like the baseline started changing. And then it wasn't just the baseline started changing, it's that if I overdid it, again, I suspect a lot of you would be familiar with this. If I overdid it, like with that hike, I then came back down to a worse baseline.
Mm-hmm.
And I see in the comments that this is
Yeah.
people, you guys, some of you are really relating to this.
Yeah.
And eventually my new baseline was so significant that I was mostly bedridden for almost a year, where if I sat up for more than 5 minutes at a time, I'd get lightheaded, my heart rate would speed up, kind of the POTS, the postural
Mm-hmm.
orthostatic tachycardia syndrome thing would happen. And all this was happening sort of on the side while I was learning about trauma and chronic illness, not realizing I was well on my way to developing a chronic illness because the onset was so slow for
Right.
me. And for some people, it's very sudden. One day you're fine, the next day you're in it.
Mm-hmm.
Um,
Mm-hmm. So I just imagine like that must have been just as it's no wonder we have so much anxiety and depression that goes along with physical symptoms and fatigue, just with wondering like, am I going to be okay tomorrow? And then I'm not okay, and then a year goes by and I'm still not okay. And so for the people that are here, yeah,
yeah.
like it seems to be part and parcel of it, of this just trying to figure out what's going on. And then you were studying this on the side and you started to bring them together. This is very interesting. Yeah.
Yes, I'm seeing in the comments, like the corrupted cell phone battery and how awful it is. And it's very confusing
Mm-hmm.
when this starts to happen. And let me share a story.
Mm-hmm.
My husband is also a somatic trauma therapist. He also changed careers. And um, this really highlights what I started to learn. And I can show some slides about this. But he noticed one day that it seemed like he had a toothache in the lower part of his jaw. And he was kind of wondering if he needed to go see the dentist or not, because it was starting to really hurt. It was one of those pretty sudden onset. He hadn't chewed on anything weird or anything like that. But before going to see someone, he kind of sat with it. He was a long time meditator. And the thing about meditation is he also went to Naropa in the contemplative program, which is really about mindfulness.
Mm-hmm.
And the big thing about mindfulness and being in the present moment is doing that without judgment,
Mm-hmm.
without blame. And I think that's one of the tools that you guys talk about as
Mm-hmm.
well.
Yeah.
And so he noticed that he decided to just sit with it for a while. And I noticed there's some questions in there, and I'm happy to get to questions.
Mm.
And there are all kinds of things that can trigger the onset of a chronic illness. I don't know chronic pain as well,
Mm.
but I had back pain, low back pain for 6 years. It made it hard to walk and sit and be vertical. So I have some familiar with it on that end. I just haven't done the research as much. But so my husband, David, spent some time. He sat with it in a meditative mode. And what he first realized was, oh, it wasn't his tooth. It seemed to be the area in the gums around the tooth.
Mm-hmm.
And then as he spent more time, and this was over a number of days, and feel free if you want to interrupt, if you want to do questions, I can continue the
I'll
story, or I
keep
can do
half an
that
eye there,
now.
and yeah.
Half and half. This story is really a great illustration, though, of this process. And as he sat with this process with his jaw, and it took a few days, and it required being really curious and not getting freaked out.
Mm-hmm.
This is a big thing with pain and with any symptoms of chronic illnesses. Do I need to go see someone? Is there something happening I need to take care of? Or can I sit with this and stay curious?
Yes, that's it. Yeah.
Yeah. And So it wasn't the tooth. There weren't any signs of infection. He realized it was the gum around it. And then one day, a few days into this process of being with it, he realized, he had this flash go through his head. It reminded of him when he was a kid, and his father would put his hands on his jaw right there and make him look at his father's face when his father
Mm.
was telling him something.
And he had an image, or he had a thought, or he had a memory. Yeah. Yeah.
Yes, and these memories may be really sharp and clear, or they may be a hunch. Sometimes they're pre-verbal, prenatal, before you're 3 years old.
Yes.
And when he realized this about this link and got really curious about this next step, he then worked with the anger that
Mm.
came up.
Mm.
And part of what can happen, and this is a pattern in my trauma training, I ended up doing specialty training in trauma once I saw that there was a link,
Okay.
was that a child whose parent is doing this, you can easily not think this is abusive,
Uh-huh.
but it's really not allowing the child to say what they need to say or do what they want to do. And this is aggressive,
Mm.
this requiring him to look at his dad.
Mm-hmm. In
And
that
what
tone. Yeah.
in that
Mm-hmm.
tone, in that setting, it's ultimately really not respectful.
Mm-hmm.
But yeah, it has an element of abuse that we can easily override because it seems so small.
Yeah.
And what it's doing is it's truncating David's response as the child, the anger response, or the response to want to say something, or of what he wants to do that maybe his dad doesn't want him. That's,
Mm-hmm.
maybe he prefers to do this activity instead of that one. And so what it can be doing is putting a fight flight response, a healthy, normal boundary or self-protective response, and putting a freeze on it. Because as a child, you're so much smaller, you're so
Mm-hmm.
dependent, you can't actually allow your system to go into that
Yeah.
fight or flight or self-protection or speaking.
Or speaking. And so it gets short circuited, the
Yes.
the response. Yeah.
Kind of like that corrupted cell phone battery in a way, except that in our bodies, there's these little breadcrumbs. That's what my faculty had talked about. There are these clues. And so as David was parsing this out, he then allowed his system to feel the emotions,
Mm-hmm.
the anger, the grief, the rage, the impulse of what he wanted to do, and hold it in context now as an adult with all the support around him where everything's okay. And this, we'll
Mm-hmm.
often be doing this in therapy, but having
Mm-hmm.
done a ton of his own work and a ton of meditation, and he was able to hold his seat with this.
Right.
And then this went away.
And it went away.
The pain went away.
So that's such a great example of, like, so linking it, he because he knew there was a link, and then feeling what was stuck in there
Yeah.
released the this sensitization, or the message that it was dangerous, I guess.
Yes, that he was at threat. His own system was somehow under threat by
Yeah.
this aggressive action.
Right. Okay.
And
Yeah. Mm-hmm.
what that freezing of his inability as a kid to do whatever he might have needed, even to get out of this hold,
Mm-hmm.
that when we go into freeze, if we can't come out of it, wild animals do this. Peter Levine, who's the
Mm-hmm.
founder of somatic experiencing, that's the trauma training I ended up doing, is animals that have had to go into freeze to escape prey or pretend they're dead, the playing dead. It's not a conscious thing. So this central
No. Yeah.
sensitization thing is not conscious. You don't consciously, maybe partly as a kid, you might consciously say, okay, I'm not going to say anything. But mostly it's a suppression that happens because our nervous system is protecting us. It's not conscious.
Right. 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 And it's a very intelligent response
Mhm.
in a situation that you can't escape from, and you
Mhm.
just have to be quiet.
Exactly. And
Mhm.
it takes so many different shapes and forms for this having to be silent or having to hold back. Or as an adult, if you're in an accident, you may not have time to have turned the steering wheel. That can lead to a freeze response because you didn't get to complete it. And what happens, from what we're understanding through animal studies and humans as well, is that when we can't sort of complete that self-protective impulse, when it gets truncated, the brain doesn't get the message that it's over.
Right, right.
And
Okay.
that seems to be the foundation of everything that can lead to a chronic illness years later or decades later.
So it just keeps on keeping on, like the cycle keeps going, and then it develops into a symptom, is or an illness or pain, if trauma is at the root of it.
It can. And
It
part
can,
of
yeah.
what happens is that one event here and there, no big deal. We have a lot of capacity in our systems to recover, but that it's very likely pathways that are then getting strengthened by additional doses or hits, as they call it, of adversity. And
Hmm.
then what happens? Like I can't quite talk and track the chat at the same time, but I
Yeah,
know
I
one
don't
of you
know. Don't worry,
guys
I'll go back to it. I'll
will
go
have to go
back.
back to it.
Yeah, don't worry.
But one of you guys mentioned the vaccine question, and
Yeah.
um, that whatever the event that triggers the onset of this symptom as an adult, potentially decades later, it can be anything that stimulates this threat pathway.
Yes.
So it could be a vaccine, it could be surgery, it could be an infection like COVID, mild or severe, any range of infection. It could be the death of a loved one. It
Yeah.
could be a whole accumulation of things. And there's probably, a lot of people got worse during COVID because there was a level of trauma in our
Hmm.
society and in the
Isolation and
world. Yeah,
loneliness and all those things. Yeah.
yeah.
I I I'll just pop this in here and then I'll go to the chat. But I was listening to a podcast recently, and I didn't know about this, by a woman called Irene Lyon, who works with the
Yes.
nervous system. That as like, say for example, your husband with with that memory, that you can actually get um like a recurrence of, like, actually the imprints of fingers or a hand where you were hit or where you were held, even though that was when you were 5, can
Yes.
start to. I had no idea that that could resurface again in your skin.
It can,
Um,
yes, and I think it can resurface in all kinds of places, and it's not always going to be that clear. That example I find is really helpful because it's so specific. And I see, like, one of you is asking, how on earth do you process all this?
mhm.
And really, I think by the time we develop something as an adult, and for some it starts as a kid. Generally, what I've been seeing in the literature is that the younger the age of onset, the more severe the symptom, the more severe the flare-ups. Likely that's associated with the higher doses of adversity in our own lives
Okay.
and also in the lineage, in our families, our parents on either side, because that trauma is a component. And I wonder, I see there's a lot of questions, but I wonder if I could show a few slides
Yeah,
to,
yeah,
let me
yeah.
just see if I can share again. It looked like it was working before. Yeah, looks like this should work.
Yeah,
Just,
let's learn a little bit about this and then go to the questions.
yeah, just to I like the visual. I find the visual really helpful in the sense that chronic illness, chronic pain can seem like it's coming out of the blue.
Mm,
But for many people, it actually does happen after some kind of trigger. It's happened in the weeks or months or year or two before onset. And I mentioned, it can be any kind of different trigger. And in medicine, when you look at the research, a lot of times we tend to this theory we have in medicine is that there must be a different cause for each different disease. And if it's a psychological disease, the cause may be a psychological event. But if it's a physical chronic illness, like an autoimmune disease, for example, the cause must be physical.
Right.
I don't think that's the case. The research
Uh-huh.
really suggests that any one of these things that's the trigger, what they all have in common, and this is from the work of Robert Navio at UC San Diego, who's a professor of a bit of everything, pediatrics, metabolics, cell biology, genetics. His sense of it is that each one of these represents some form of threat.
Mm. Oh, the
And,
nervous
and
system is it's all one nervous system.
yeah, and so an infection is a kind of threat that our body knows how to defend itself against, but it ends up being the last straw that strengthens a survival pathway that's been building over years and turns it on so that that baseline then changes.
Hmm.
This
So
is
you already
how,
have some level of sensitivity in your nervous system.
yes.
Hmm.
And that was the theory I discovered. He calls it the undersea volcano. The red part of the triangle is just the tip of the volcano that we were seeing here. But actually, this is Charles Poser, who did research in multiple sclerosis. And what he was seeing was that there seemed to be some environmental risk factor going on years before onset, because they could see some of the changes in the brain and the body that we associate with MS, but people didn't have any symptoms. And it seemed as though these symptoms, the initiation of risk, happened very early in life. Way over here, that little volcano is tiny, possibly in the pre and perinatal timeframe. That was his hypothesis. And
Mm.
that there may be additional events in childhood, and then maybe additional events in adulthood, depending, of course, when things started. And then there was this last straw event, and then the symptoms became visible.
Just poke through the surface or
Yeah.
burst through the surface. Right. Okay.
Yeah. And his research was supported by research I found in other areas. So these little colored dots I use to represent antibodies. In type 1 diabetes, for example, they find that people who develop type 1 often have had antibodies for 10, 15 years before the onset. They found that in rheumatoid arthritis. They found it in lupus. They've even found some in Parkinson's disease, even though we don't think of Parkinson's as autoimmune.
Hmm.
And that it's an increasing number of antibodies and an increasing diversity of different kinds of antibodies that they see. As those numbers increase in type 1 diabetes, risk increases.
Right. Okay.
And so we see the same pattern as in the MS, that it seems like there's this, what they call a latency period, all this time period where there are no symptoms that we can see.
Hmm.
But in some autoimmune diseases, we could actually measure the antibodies if we were to look.
So that's so interesting. Because then we're all about like just treating the symptoms when it bursts through the surface. And I'm wondering, for people who have ongoing pain, um, if it would be like a combination of and again, like, sometimes it's childhood adversity, sometimes it's a car accident as an adult. Um, and there was one question that came up that maybe we could uh, just pop in now, because I'm sure a lot of people might be thinking, like, how, when I look at this, like, how do I know, and how do I break that loop of anxiety and pain?
That's
And
ultimately,
the idea that the pain actually becomes traumatizing. So then you
yes,
have this helplessness because the pain won't stop, and it becomes a trauma in itself.
yes. Yeah.
It's
And
probably
then
it sounds like a lot for people.
it's a lot of layers. And one thing that's really, I think, helpful, and I only have a couple more slides, and then
Mhm.
let's talk specifically. One is that this process here is that the antibodies have been observed to decrease. And for some people, they go away before they ever get sick, before they ever get type 1. And so there's a reversibility. And this is also speaks to this sense that it's not, at least for a certain amount of time, this is not an impossible, irreversible thing that's going on. There may be a component of the nervous system process or of, if there's enough support, we are designed to recover from stress and trauma. So that piece is helpful. And we do see in the research that having enough support in early life, in these time periods, even as an adult, when an event could be traumatic, like if there's enough support during a car accident and you know you're okay, or you know you're safe, or that our bodies can recover. Ultimately, part of what makes, I think, this so complex for so many of us to recover, I'm doing much, much better with my health, but I'm not back to this normal where I can go hiking for 3 hours.
Right.
And so there's a process. And part of why it can take so long is that there's all these layers, the ones that trigger things, the events in adulthood, the events in childhood. There's all kinds of layers. You mentioned adverse childhood experiences, the ACEs that many of you, I imagine, have heard of, but that also influences our relationship with our adult caregivers. I could think of that as its own separate component. There's research in babyhood events, and then there's research also in the trauma in our parents' lives and our lineage, and institutional trauma, sort of the lineage people come from, if you're Jewish, if it was the Holocaust, if it was enslavement. And so part of why I think this can really take time and effort is it's a process, is that there's so many layers in our systems. And I can speak more to that, but let me get out of the slides and let's see what the questions are and see where we want to go from here.
Yeah, yeah. There, lots of, thank you so much for everyone for just, sharing your comments, because I think that even helps people to see, that this, that they're not alone. And, when we're talking about support, sometimes this can help just to see that.
Yes.
Yeah.
I'm
How
looking
on
at the
earth do we process
questions as
it all?
well.
I think with chronic pain that came from an accident, the trap sensation may not actually be directly related to the accident, but from something else.
It could actually, that's a really interesting thing to comment on. It could be linked to the accident, and it could be linked to, being locked in a closet as a kid or having had something happen as a kid. And we are talking about trauma here, so it can be activating. And so part of just today here can also be of what are all the tools that we can use? And it could be like just taking a deep breath, remembering we're in whatever space we're in right now, feeling the seat or the cushion or the floor, really coming back into present moment, right here, right now, right in this moment. I am okay in this moment. And that's part of conveying to our nervous system from this adult place that we're in. It's a sense of safety, relative safety in this moment. And that's one of the ways that we can counteract this pull of the urgent trauma components.
Yeah. I have a question about that. And hopefully just as we're talking, maybe everybody just keeps on breathing and noticing your feet on the floor, and that we're right here, because right here, right now, that is part of the treatment, really.
It is.
I have wondered do we always have to go back to the trauma, or building safety like we just did, building safety in our body, can that sometimes help to resolve a lot of things?
Yes. And I see a lot of people are asking questions about this takes a lot of work.
Mm.
This is not, by the time we have a symptom, it's not usually a single event. It's like all those little volcanoes that have been building over time.
Mm.
So I see it honestly as a lifelong process, lifelong practice. And I don't think that the things that we do to help calm our nervous systems, Irene Lyon talks about this a lot. She's a somatic experiencing practitioner, also trained, along with some other things that she does. Those things help calm our systems. They help us come into the present. They help us be curious so that we can work with the trauma.
Right.
And my sense is that we actually need to work through the trauma pieces,
Mm.
and that all these other tools can actually make that easier and help that process.
Mm.
But that part of why it takes so long is that if we're not addressing the signaling of danger coming from our nervous systems and our brains,
Mm-hmm.
we're calming things down, but we're not changing the signaling. And the signaling of
Yes.
that pathway, if it's been developing for decades, like we see with the antibody studies, and it looks like a lot of things may be initiated in babyhood,
Mm.
they've been established for a really long time, and it takes time to convey all these different messages to these pathways.
Right. Yes. And I can absolutely relate to that, to going to yoga, going to mindfulness, practicing mindfulness and all these things that, are calming and relaxing, and yet can not always get to actually shifting the state, like just kind of like it's all good
Yes,
stuff.
it's good. It's really good.
And then sometimes after a few years, even starting to notice, this is coming up now, and maybe the system was just safe enough that it was had the capacity for that to come up. Uh,
Yes,
you know.
which is also big. And a couple thoughts in there. For some people, feeling safe is not safe.
Mm-hmm. Yes.
Relaxing beyond a certain point can actually stimulate a certain amount of activation or hypervigilance, because as a child or in some previous circumstances, it would not have been safe to let your guard down.
Mm-hmm.
And so, from a mindfulness curiosity place, we have no judgment about that. All we notice is we notice this and we learn this about ourselves, and then we can work with that.
Right.
And
Without
so,
judgment. Yeah.
exactly. So then, if we do yoga, we notice, okay, they're going really deep into the safety thing. I'm going to hang out a little further out over here.
Yeah.
And that's part of how we learn and incorporate these tools into our daily life.
Right. Yes, that makes so much sense. And the idea that uh, the sensations or your state doesn't mean anything about you,
That's
but
right.
it's information. And
Yes.
if we can get to that without going into too much reaction, okay, this is information that's happening right now. We can get a little bit of distance from it and perhaps work with it.
The distance is key. It's a huge practice to gain distance. And we call that in therapy language, we call that differentiating from the symptoms, so that you're not 100% pulled into believing it, because a lot of where our symptoms come from is the past.
Mm-hmm.
And it's our body that actually kept us alive long enough so we could work through it later.
Mm-hmm.
And I saw a question someone asked, are
Yeah.
flashbacks potentially linked?
Yes.
Absolutely. Flashbacks, nightmares, those often will have some seed of content linked to what this may be relating to from
Mm-hmm.
the past, for example.
Mm-hmm. Absolutely. So I'm seeing lots of great comments, and I apologize if I have missed some
Let's take some
questions.
time and see what what folks have.
Yeah. Yeah. Yeah, our medical system is absolutely not set up to cope with the trauma. They um, oh, here's one. I've been falling a lot lately, and the damage is greater with each fall. What could the underlying reasons be? Could this be related?
These are really good questions
Mm.
because it's going to be so different for each one of us. If you go see, like people have asked, how can I have my GP help me?
Mm.
And part of it is how do we educate GPs and family doctors and medicine, all specialties in general, to understand this component? Because as another person mentioned that I saw, getting diagnosed, and you mentioned this, Madeline, getting diagnosed can be traumatizing.
Hmm.
Having the diagnosis and the symptoms and the pain can be traumatic because it feels like there's no escape. Also, going to see people who don't believe you, who don't see you, that's traumatizing, and it's often reenacting what we experienced as kids of not having been seen or believed.
Absolutely.
Um, and so for a lot of folks, if your GP or your doctor does nothing more than believe you, that's already changing the paradigm.
Yeah. Yeah,
That's
there's research for that, isn't there? A lot. Yeah.
yeah. And so I forget where there was another question here, but all of these, the falls, as a medicine in medicine, we would be curious about 8 different things, for example, and we'd look for
Mhm.
those. As a trauma therapist, I would explore what happens around the time of the falls. Is there a trigger happening around the time of these falls? What might be stimulating it? Might it be a weakness in a physical part of your body? Might it be a dizziness thing? But could there be something like where you actually numb out or dissociate or leave your body for a moment?
Mhm.
Those are healthy, normal ways in which our bodies cope with overwhelming feelings or emotions. That's what numbness does. It tries to freeze out what's too much.
Mhm.
And you mentioned earlier, Madeline, where it's also about growing our capacity. And as we grow the capacity, that's when we might be able to feel a little bit more or
Yeah.
feel some of the old grief that we couldn't, or the old fear, and so that's part of where it's a
Yeah.
process. It's really
Yes.
an adventure and an exploration and a being curious to see what your body is saying.
Yeah. Yeah. And I do like the idea, although it might not sound very that great to other people, that of it being a lifelong process, because with or without pain, we are always dealing with things that are sometimes feel overwhelming,
Mhm.
or that we don't have the safety to be able to express in the moment. Maybe you have a boss that continues to shut you down, or where you have to stifle your voice. Like um, all of these things can add to nervous system danger signals. Um,
Yes.
so just being aware over time, throughout life. Yeah.
Yes. And I just see that Mark wanted
Yeah.
to be let back in as a panelist.
Yeah, I saw that. I'm gonna let him right back in at the end, and sorry, Mark, just because they don't have him on the screen. Um,
Okay, I
yeah,
see another
yeah,
question. Yeah,
yeah.
go
Why
ahead.
don't you have a look through the questions and see
Yeah.
what you're finding?
Yeah. So one of them is isolation from the medical system can be traumatizing. Isolation in general can be traumatizing, yes. Telling the story over and over can be traumatizing, absolutely. And this is where when you're working with someone who's familiar with trauma, it's not about, like in medicine, we actually are, when as a doctor, we're doing someone's history, we're actually tracking all the most traumatizing things you have in your history. And so in therapy, often we're not going to go through the whole. Some people might, but generally you do it in what we call titrated,
Mm-hmm.
small bits. We don't need to know the whole story because the past shows up in the present.
Mm-hmm.
The falls or the weakness I saw a few of you mention, there's usually going to be a trigger before a flare up or a symptom happens. And that trigger is usually linked to the past but you can just work with the trigger in the present moment. You don't
With what's
have
happening
to
now.
know.
Yeah.
Yes,
Yeah.
and you can do it by being curious about the body and about sensation and looking for images like my husband David did, or
Mm-hmm.
looking for any links. And then you can work with that in this present and let the story go
Mm-hmm.
and see what the body wants to do. And it may actually just need to feel a moment of the fight or the flight response. And then your body actually, with the help of a therapist, it wants to shift back down, integrate it, and then it comes back down for a moment.
Right.
This is the small step-by-step way. And
Mm-hmm.
someone asked about hypnosis. Yes, there are many, many, many different ways of working with trauma. A lot of them, I think, they really need to focus on the sensation in the body. You can't think your way through it because it's not all aware. We're not aware of a lot of it. And
Yeah.
so you can't just talk your way through
Mm-hmm.
it.
I think
Um,
that's such an important point, how talk therapy has changed to more somatic therapies, because it's trauma, pain, anxiety are actually showing up in our bodies. Um,
yes, they are. And, one of you is saying, and just for confidentiality, I'm not using your names. Does it matter? Is it okay to use names or from the
oh, it's
chat?
either way, it's yeah, maybe not. Like then we can
Okay.
just put the recording up. Yeah.
Yeah, because I see, this question about
Mm-hmm.
how it ends it up despite the darkness can be a real gift.
Mm-hmm.
And
Okay.
I'm really cautious about that. I find my own has been a gift in many, many ways. And I still have a lot of grief from everything it took away from my life that I couldn't pursue. But the gift of the things I would have never learned if I hadn't been pushed to do this learning and growing in therapy that I probably would have never done.
Yeah.
Someone's talking about Christiane Northrup. She's an OBGYN who talks a lot about symptoms like menopause and fibroids and more than that. People who experience childhood abandonment may have RA, rheumatoid arthritis.
Okay.
It's bigger than that. The adverse childhood experiences, those are 10 specific types
Mm-hmm.
of adversity in childhood before your 18th birthday, like abuse or neglect or losing a parent. Any of those are associated with a higher risk of pain in childhood and as an adult, and with chronic illnesses of all kinds, including autoimmune diseases. So it's not just RA. Emotional neglect and emotional abuse, I think of those as what we now often call complex PTSD,
Mm-hmm.
developmental trauma. I did a survey on my blog, and it is so common in
Mm-hmm.
chronic conditions that people did not experience what our nervous systems are designed to experience for our own health is nurturing and kindness and safety and being protected and held.
Right. Right.
And so when that's missing, it actually really influences the genetic function through the epigenetics, the molecules that attach to our genes
Right.
that determine if our bodies and our nervous systems perceive the world as safe or not.
Right. Yeah. Yeah. And I think I just wrote ACEs in the chat. It's the adverse childhood experiences that you can take the quiz and online and see what your rating, I guess, is of ACEs. But I first got into contact with you, Veronique, when it was the first time that I had realized that the ACEs does not cover certain things that I had experienced and other people that I was working with had experienced. So, and that is exactly what you're talking about now, the stuff that didn't happen. I didn't see that reflected in the well-known ACEs study.
Yeah.
So
I
yeah,
call those missing aces.
the missing ACEs. Okay, if people can be
Yes.
aware of that too. Yes,
Yes.
I thought that was so important.
Yes. And a lot of people who take the questionnaire of ACEs and find that they have a score of 0. When I first took it, I was early in my researching this, and I thought, oh, that means I didn't experience trauma, which is not the
Yeah,
case.
no,
You
I
know,
found that too.
I see some questions you guys are asking, if
Mhm.
this or this or this happened when I was a child, would that be considered trauma? Absolutely. And a couple resources. I see that we're close to the hour, and
Mhm.
I'm wondering about
Yeah,
providing some resources.
yeah, yeah,
On my,
absolutely.
yeah,
Yeah, explain, that's a good question. We have a family member who thinks our condition is psychological and in our head. How can we best explain and that's something that we have touched on in different webinars. And I think the very first step is probably just realizing yourself that it's and some people um it's really difficult to you probably found this too as when you got sick, that some people won't hear it, and it's a lot of energy to explain it. um but I think that's something that we can do in another, I think we with in another webinar that's coming up, because it's a hard one. um what I want to does happen to have the link to the ACEs.
I have the ACEs survey on my blog, and I
Okay.
also, if you look on my blog, if you provide the link just to my blog, chronic illness traumastudies.com,
Yes.
you will find a lot of resources there that might be helpful for some of the questions you guys are asking, really important questions. One of them is under types of trauma. You'll find ACEs. There's a detailed blog post specifically about ACEs research in chronic illness.
Darn it. I'm not sure why it's not pasting.
Okay.
Sorry.
Dr.
So because I had it all ready to go. It's chronic illness studies,
Trauma Studies.
trauma. I'll just write it down here.
Studies.com. Christiane Northrup is the doctor that was mentioned earlier. So if you look under the menu and you look under trauma, you'll see ACEs there, and there will
Mm-hmm.
be a blog post about it. If you look under surveys, I have a lot of surveys. I have the ACEs survey, and I have a whole bunch of missing ACEs surveys. So if you went to the blog page under surveys, if you look at the menu under surveys, it'll say all the surveys. You can go to that one and look at all the different ones, and that'll
Okay.
give you an idea of the enormous range of
Mm-hmm.
what trauma can look like. Um,
Yes, I recommend that everybody takes a look at and I'll send out the website with the recording, because, oh, thank you, Cease. Thanks. I don't know why I couldn't paste it in there. There we go. Um, it really is a fantastic resource of many, many different things at your fingertips. It's very interesting. Um, yeah. I just want to mention a couple of things. One is if you are looking for a therapist, to look for in somebody in Kelowna who is experienced in, or wherever you are, somatic experiencing. And I also did see with a company called Sounds True,
yep.
that Peter Levine, the creator of somatic experiencing, he has an online course for people with chronic pain that is actually, I believe it's still on sale right now, on the Sounds True website. And I was looking at it myself, wondering if I should. You're in the course page. Oh, fantastic. Okay, that's great. The other things that I wanted to mention, on November 28th, I am doing, it's a 4-hour online retreat for um, for patients of the pain clinic. and on embodied healing. So transforming pain by befriending the body. And we're going to be doing a lot of what we're talking about tonight. So we're going to use a lot of practices to do with the vagus nerve and all kinds of ways of just starting to get some practices of mindfulness to start befriending your body. So that went out in a link and it should be up on the website. If not, I will put it up tonight. Make sure that if you can, that would be a great thing to attend. The last thing that I want to add on is that someone called Dr. Ariel Schwartz. Are you familiar with her too? Yeah.
Yep. Friend and colleague of mine went to Naropa, same program as
Oh,
me.
okay. Same
Yeah.
people.
Yeah.
She has some nice free classes and practices on her website as well, so that you can just start little by little, start to practice, start to investigate, start to get curious. As Dr. Mead was talking about, all the different to start exploring the layers. Oh, it's not in there. Hey, Brooke. Okay, maybe I just put it out in the email. I'll make sure it's in there tonight. Yeah. So I think the last name, okay, of the person I just said was Ariel Schwartz, and I popped it in the chat there. So there are some resources just to build on what Veronique was saying tonight about how this might be an avenue, it might be a doorway into further healing for pain that persists. Oh, I just want to let Mark back in here. Veronique, I'm wondering if there's anything else that you'd like to just add before we end for the night.
I think a lot of questions are, how do we do this? And you've just talked about those. And I have resources on my website to help you find ways with this. So one of them in the menu is called Fact Sheets, where I've summarized on one page what some of the research is for either a specific chronic illnesses or the ACEs. Sometimes that's a way to tell a family member, it's like, look at, this is the amount of research about the role of ACEs in chronic health conditions. There's a few other fact sheets. Sometimes that's helpful to give to your family doctor or the doctor you're working with. There's also a blog post I just rewrote and published today. If you look at blog, that's actually, you can subscribe to get blog posts with some of the research that I share. And the one today, I call it 16 trauma-informed tools.
It's a good one.
It includes the trauma pieces, so working with trauma in general and attachment trauma in particular, which is what Ariel Schwartz's specialty is. Those, along with all these other tools, are a way to add in the layers.
Okay.
And I have a page to find a therapist. And I also offer consults. Sometimes it's helpful to just go through it and see how might you put it together. I don't do therapy anymore, but I help people look at the trauma piece to make sense. And there's a ton of resources of just books to read about this. So there's really a lot of information out there and just how you get started.
Yeah.
A lot of support out there, and you aren't alone. I saw someone saying that. We are not
You're
alone.
not alone.
You're not
You guys
alone.
are not alone. Yeah. I really, really recommend that. I haven't found such a comprehensive website before. And if you just start tucking into that, you will find, and that last blog that came out today, I think I sent it out in the email actually earlier to everyone, like the 16 tools to start, just to begin. That was a great one. And as you say, you offer consults to people just to kind of get a picture of what's happening. That might be really helpful for some people as well. So yeah, so lots of thank yous, and it's on, Teresa, it's on Dr. Mead's website, the page to find a therapist. Yeah, so much covered. Thank you. Yeah. Yeah. Oh, you're very welcome. Great. Well, we are just after this time goes so fast, and I know there's just so much to say about this topic, but I really want to thank you for everything that you've covered tonight, from your own experience to how this actually can develop over time. And hopefully it just brought a lot of, a lot of sense to people, that just making sense of your own symptoms, and it's not in your head. You're not going crazy. This is a real thing. Yeah. So Mark, I'll turn it to you to kind of close us up, but kind of bookend on this end.
Yeah, I mean, to Veronique, thank you very much. That was an amazing webinar, and to Madeline for hosting it. It's been really great. Thank you. You covered so much, and I hope for the patients it's provided them with, some hope and some insights as to an understanding of what is going on and what they're dealing with. It's been great. I mean, I'm just looking at the comments. It's been fantastic. So yeah, so yeah.
Great. And I will send out Veronique's website. Oh, there we are. Oh, you know what? I think you just sent that to us, Veronique, instead of to everyone.
Got it. Let's see. I have
Got
it. Let me repaste it to everyone.
And do you have a newsletter that, yes, you do, because I get it.
Yeah, you can subscribe and get the blog post for free. Yeah.
Yeah. Yeah. Great. Yes. And I will send the recording out. Yes. All right. Well, thanks to everyone for coming tonight, and thanks for joining us from Boulder, Colorado. And wish you all the best, and keep going with your investigations. And we'll see you all again soon.
Thanks very much.
Okay.
Thanks, everyone.
Okay, thanks. Good night.
Good night.